Okay, good evening, everyone. Thank you to those who are joining us tonight. My name is Andy Lynn James. I am the Family Support and Inclusion Specialist here at the Trenton MFRC. I am joined by Stephanie Nelson, a registered occupational therapist. She is here tonight to talk to us about all things picky eating, which seems to be a pretty hot topic, especially among parents. So I'm going to throw it over to her in just a couple minutes. And at the end, there will be time for some questions. So if you think of any questions throughout the presentation, we will have time to answer at the end. Feel free to drop it in the comments, whether you're joining us here on Zoom or on Facebook, or you can email me. I will drop my email in there as well if you're more comfortable that way. And we will do our best to get to all those questions at the end. So I'm not going to take up too much time. So Stephanie, I'll just hand it over to you. I'm going to turn off my mic and my camera so I'm not distracting, but I'm here if you need me.
Sounds great. Thanks, Andy Lynn. So I'm Stephanie. I am an occupational therapist. I work in pediatrics. I deal with picky eating a lot in my caseload. It's one of probably the most common reasons that kids get referred to us. I myself am a recovering picky eater, so I know what it's like to feel the shame and to feel the embarrassment and the frustration that comes along with picky eating, especially once you start to get a little bit older. It wasn't until university that I really started to push myself outside of my comfort zone and start trying new foods. When societal pressures started getting a little bit more present, and like my friends would want to go out for sushi, but I wouldn't like sushi, those kinds of things. So I understand how these kids feel. I understand the anxiety that comes along with it. And hopefully I can help some kids so that they could start eating healthy foods earlier on than I ever did. Just before we get started, I want to make a note that this is not meant to replace therapy. If your child is a really picky eater or a resistant eater, which we'll talk about in a bit, I do recommend having an individualized therapeutic approach. We'll talk about lots of reasons why there could be a picky eating issue. But yeah, this isn't meant to replace therapy. It's not a super comprehensive presentation meant to replace the need for a therapist. I'm hoping that I can just give you some insight on why your child might be struggling and give you some recommendations on things to try. So I'll start sharing my screen here. All right. So occupational therapy, in short, basically what we do is we look at daily function. So
sorry, Stephanie, we can't see your screen.
Oh, you can't see it? Sorry. Sorry about that.
There we go.
I thought something was wrong. All right, so we're good now?
Perfect.
Okay, sorry about that. So yeah, occupational therapy, basically we're looking at daily activities and how well people are engaging and what they want and need to do throughout the run of the day. So when I'm working with kids, I'm looking at things like, are they able to sit in a class? Are they able to learn? Are they able to go to gymnastics without having a meltdown? Are they able to sit at the table and have a meal with their family without having a meltdown because the food is too overwhelming for them? Those kinds of things. If you guys have any questions about OT, we can certainly talk about it later on. But I want to get going because I have lots to talk about tonight. So we're going to talk about the definition of picky eating, the prevalence of picky eating, some of the myths surrounding picky eating, what some of the contributing factors are to developing picky eating, where to seek help, and then I'll get into some general recommendations and leave some time for questions and discussion at the end. All right, so I always look at picky eating as a continuum. So you have your normal, quote unquote, typical eaters on one end of the continuum, and then on the extreme other end of the continuum, you have your resistant eaters. Somewhere in the middle is your more common picky eater. So when you're looking at resistant eaters, you're talking about a child who eats 10 to 15 foods or less. So really, really, really limited diet. They completely refuse one or more food groups. They may have anxiety or tantrums when they're presented with new foods, and that may even lead to gagging and vomiting because they're so worked up. And then they may experience food jags. So food jags are when a child gets very fixated on one kind of food and then will eat that breakfast, lunch, and supper every day for 2 weeks, a month, and then not want that anymore, but want something else. So we see that commonly with things like pizza, macaroni and cheese, peanut butter and jelly sandwiches. They'll only want that for a short period of time and then switch to something else and not want that other food. So having food jags is one of the signs that your child is more of a resistant eater than a picky eater. So prevalence of picky eating, there has been quite a lot of research that's been done, but no consensus has really been reached on just how common it is to have a picky eater. The research that's out there shows that it's anywhere from 7.3 to 59% of kids are picky eaters. So it's a huge variety or a huge range that's not really helpful. A lot of the disparity comes from questionnaires asking parents if they feel their child's a picky eater versus giving structured definitions. So you're getting parent feedback, you're not actually doing studies based on how a child is presenting, and there's no great definition for what is a picky eater, what is a typical eater, what is a resistant eater. Even between sexes, there's a huge discrepancy. So I want to talk about some of the myths that are associated with picky eating. So myth number one, my child won't eat because they're just being stubborn. So I hear this a lot. It's easy to assume that a child's refusal to eat is their way of asserting control over the situation. However, behavior is usually one of the least common reasons for a child being a picky eater. We will talk more about that, but just keep in mind that your child isn't trying to completely drive you insane with their picky eating. Usually there's some other underlying issue than just being stubborn and not wanting to eat. So myth number two, a child must learn to eat everything on their plate. So this actually came from a World War I campaign called the Clean Plate Club. And it was an effort to conserve limited food supplies. So basically people were being told, finish everything on your plate because food is so limited right now. It's a very outdated way of thinking, but it really persists in our culture right now. We often comment on, oh, our child's such a good eater, or oh my God, your child eats so well, when a child clears their plate. I know even myself and my husband make those comments about our son all the time. So yeah, there's a few problems that come up from this. As adults, we're not very good at knowing how much food is the right amount for a small child. Plates that are designed for kids are way too big for them. I know my son's plates are almost as big as our dinner plates. Like they're a good sized plate. And so it's hard for adults to judge just how much food to put on the plate because typically we want to fill that whole plate. Secondly, the pace of eating that adults are used to eating at is much too fast for a child. So especially a child who has motor issues, who has sensory issues, it takes longer to figure out how to process these things, how to react to these foods. And so if we're eating at a really quick rate, it's way too fast for kids. They're going to get overwhelmed. Cortisol is going to go up. They're going to shut down. Forcing a child to eat once they're full completely distorts their natural ability to control their diet. So basically we are overriding the signal that their brain is sending to them, or that their stomach is sending to their brain saying, hey, I'm satiated, I'm full, I don't need any more food. And then if we have that external voice saying, eat more, eat more, eat more, we're overriding that. And that can lead to long-term issues with not knowing when you're full, overeating. It can have issues with anxiety or with anorexia, bulimia, all that kind of stuff down the road. So it really impacts their innate ability to control their diet. Myth number three is that picky eating is the result of bad parenting. So parents often feel at fault when their child isn't eating the way that they should picky eating. This stresses parents out, which in turn stresses the child out. Everybody ends up in some stage of fight, flight, or freeze. And then when this happens, the appetite is naturally suppressed. So there's a lot of genetic factors that can also impact a child's food preferences that parents have no control over. Parents really need to learn it's not their fault and try not to stress about it. A lot of food therapy, feeding therapy is just about having fun. And so we need to not feel all of that stress and that guilt and take that on as parents. Myth number 4, if a child is hungry enough, they will eat. This approach can seriously backfire. So think of eating as any other learning curve that you experience as a child. So if a child was having difficulty learning to read, we wouldn't force them to read the same novel that we were reading. We would give them an easier novel. And so we would meet them where they're at and then increase those skills. If a child doesn't have the skills necessary to eat certain foods, they're not going to just gain those skills. So we need to bring it back and meet them where they're at and slowly build on what they're able to do. So there's a lot to learn that we can't expect kids to automatically know. We can't expect them to know every taste, every sensation, every smell when it comes to eating. Especially like adults have much more complex palates than kids have. And so a lot of the foods that adults prefer, it's too complex for a lot of kids, especially picky eaters. And myth number 5 is that eating is a simple process. There is nothing simple about eating. And just some of the things that can impact it are things like decreased attention, unable to modulate environmental noise, so the inability to block out background noise, being neophobic, so being afraid of new foods, having a lack of routine, having food intolerances, experiencing acid reflux, being unable to coordinate the tongue, being super taster. So these kids are kids who, if a typical person tastes like this much, a super taster gets so much more information to their brain about a certain type of food. And then the opposite is being a non-taster. So these kids get absolutely no information about what that food tastes like. Different cultural beliefs can impact a child's relationship with meals, having anxiety, we talked about that already, poor core strength, inadequate postural support. We all know how uncomfortable it can be sitting on a bar stool for a long time with our back poorly supported and our feet not supported at all, just kind of dangling in the air. That has a huge impact on some kids. We'll talk about that more in a minute. Being overstimulated by smell and taste, having a developmental delay, so things like Down syndrome, having weak oral muscles, parent-child interaction around food. So if the parent doesn't have a healthy relationship with food, oftentimes children won't either. Oral health, so are there cavities? Is there, gum pain? Are there like sores in the mouth? Poor breathing patterns, if you can't coordinate, even as an infant, that suck, swallow, breathe reflex, that has an impact later on in life. Having a lip tie, tongue tie, cheek tie, all impacts how well the mouth, tongue, the lips, all of that moves. Having a small airway. And then this is just a quick little reference to look at all of the steps to eating. So I think there's 32 steps to eating. Essentially, you need to be able to tolerate being in the same space as a room or as a food. So being in the same room as a given food, being able to look at it, you need to be able to interact with it. You need to be able to smell it, touch it, taste it, and then finally eat it. So figuring out where your child is on the spectrum can really help guide the next steps to picky eating. You can find this online. It's available through Google, I believe. So as you can see, there's nothing simple about picky eating, about eating in general. It's all very complex. So some of the contributing factors that we're going to talk about today are motor skills, having sensory issues. If you guys want to learn more about sensory issues, I did do a whole presentation a little while back. The video is still available, so you can go check that out. Having emotional needs, having medical needs, as I said earlier, having a developmental delay or some kind of a diagnosis, environmental contributions, there's cultural contributions, and then of course there's behavior at the very bottom. So for motor skills, what we need to keep in mind is that it's kind of like a pyramid. So at the bottom, we have our core strength. That is the foundation. We don't have good shoulder strength. We don't have good fine motor skills if our core isn't strong. Same thing, we don't have good ability to control our jaw and our tongue and our lips, all of that, if we don't have a good core. So that can be either being really well supported so that our muscles don't need to work as hard, because if you're flexing your stomach and you're just trying to stay upright, your jaw is going to get really tight as well. And so you're not going to be able to move food around in your mouth. You're not going to be able to chew, especially like things like steak, right? Like you really need to chew it. And if you're constantly focused on activating your core, you're never going to have that ability to use your muscles, the muscles in your mouth, the way that you should. When we're talking about sensory, so there's all of the sensory systems impact eating in some way. I'll go through them all quickly. Like I said, there is a whole other presentation on this. But if we're talking about tactile, so that's our touch system. A child who's under responsive to touch, so a child who doesn't feel touch the same way, like they would get less information about touch. They may seem unaware if something's touching them. They may be unaware if there's mess on their hands or their face. These kids may have difficulty holding and using utensils, and they may use their mouth to investigate objects beyond the age of 2. So those are things to look for. If your child's a picky eater, if they're doing some of these things, it could be a sensory thing. A child who's over responsive to touch, so even the lightest touch sends them like into fight or flight. These are kids who don't like messy play. They don't like lumpy foods. They need textures to be like perfectly smooth. They might dislike having their teeth brushed, all of those kinds of things. So the next one is taste, so gustatory. So we taste through our taste buds on our tongues, and we have taste buds on our cheeks as well. And that's how we interpret salty, sweet, sour, and bitter. It's important to keep in mind that children respond differently to taste than adults do, and we tend to lose taste buds as we age. So adults often require stronger tasting foods than kids do because we're losing taste buds. Some children are less sensitive to taste, whereas other children have an increased taste sensitivity, so it is very individualized. And I actually listened to a really interesting thing a little while back that was talking about how around the age of 2, it's very common for a child to start becoming a picky eater. And what they were hypothesizing was that if you go way back to like caveman days, that was the age when kids started to kind of wander away from their cave a little bit, wander away from mom, and kind of fend for themselves just a little bit. And so they needed to develop a stronger sense of bitter in order to keep them safe. So if they were eating berries and they were bitter, they would know to spit them out. So having that heightened sensitivity was actually a survival mechanism. So that is something to consider. If all of a sudden your excellent eater is super picky, it could just be like evolutionarily something is happening. So children who have a decreased taste sensitivity may try licking or tasting inedible objects. They may prefer really spicy or really salty foods, or they may prefer really hot or really cold foods just to get that alertness in their mouth. Children who have increased taste sensitivity, they may object to certain tastes, certain temperatures of foods they may not tolerate. They may gag often when they're eating, and they might prefer bland foods. So these are the kids who prefer the white diets. So bread, rice, mashed potatoes, chicken without anything on it, very white diet. So olfactory, our sense of smell, is the next sensory system. About 75% of what you taste actually comes through your sense of smell. And that's why food tastes so bland if you have a head cold. This is important to keep in mind for those kids who have like chronic sinus infections, they're chronically congested, they're probably not getting a lot of taste from their food, so it's probably not super enjoyable for them. Without the combination of taste and smell, you're really not going to be interested in eating. So vision, a child with visual difficulties might have a hard time with hand-eye coordination, visual perception, spatial awareness. During meal times, they may shield their eyes. They might be sensitive to light. It might just be so much information coming in that they're not able to really process what's around them because it just their nervous system's already on overdrive. They may have trouble reaching for a cup or a utensil. They may have trouble guiding their fork down to pierce the piece of chicken in front of them. They might be easily distracted by objects in the background. So there's lots of reasons why vision can impact eating. So auditory, children with auditory dysfunction may be overly distressed by loud noises. So like the blender may send them into a state of fight or flight. They may have trouble blocking out background noise. They may have trouble attending to and following verbal instructions. So they may not fully grasp that it's time to stop playing and go sit at the table because that verbal instruction is just too much for them to process. There's been a bunch of research studies that have looked at the effect of background music on mealtime behaviors. And they found that when there was soothing music playing, the patients of the study ate more food, they were calmer, and they had reductions in agitation, fear, and depression during the meal. They actually spent more time at the table and ate more calmly. So hearing can have positive and negative effects on eating. There's also something called misophonia, which I have a few clients that I'm working with right now with misophonia. And that's when they hear somebody else chewing or breathing, it like sends them through the roof. And so it's really hard for them to eat in social situations or even sit at the dinner table with their family because the sound of chewing is just, they cannot get past that sound. So proprioception is the ability to know what's going on in our muscles, joints, and tendons. So like I can put my hand in a fist and I know exactly where my wrist is, where my fingers are without looking at my fist because of the information that my muscles, joints, and tendons are sending to my brain. For proprioception, our largest proprioceptor is actually our masseter muscles. So if you clench your jaw, you can feel your masseter. It's a really hard muscle. It's our strongest proprioceptor. So if we're not getting good input into that muscle, we have no idea how hard to chew or how long to chew, where our jaw is in relationship to our food. So it's really hard to move food around, to chew it, to swallow it if we don't have good proprioceptive input. Vestibular. So vestibular is knowing where our head is in space. So are we upright? Are we holding still? Are we moving back and forth, side to side? Are we spinning in circles? Are we upside down? All of that activates our vestibular system. And so most cultures sit to eat, whether we're sitting on a stool, we're sitting on the floor, we're sitting in a chair, we're all sitting. And in order to maintain an upright position and keep our airway open, our vestibular system needs to be working properly. So if it's not working properly, the tendency is to move around, wiggle to get that information. That can lead to issues with swallowing because we're moving our throat around. It can lead to issues with breathing, all of those kinds of things. So these kiddos that crave that movement, they tend to get up a lot from the table. They have a really hard time sitting still. They tend to be drive-by eaters or grazers. They'll come, they'll pick something up, and they'll walk away from the table. A course that I recently took talked a little bit about at what age it's appropriate for a child to be able to sit at the table for an entire meal. And it blew my mind. She said that it's around 6 years of age for a girl, and it can be up to 8 years of age for a boy. So they have to be between the ages of 6 to 8. Most kids anyway need to be between the ages of 6 and 8 before they're able to regulate their bodies, have enough awareness in their body to be able to sit at the table for an entire meal. Having really great engagement with the parents can increase oxytocin. And so that can increase the likelihood of a child sitting at the table. But that 6 to 8 range is a pretty typical expectation for kids. And then interoception. So interoception is knowing what's going on in our body. So are we hungry? Are we thirsty? Are we tired? Are we cold? Do we need to go to the bathroom? All of those kinds of things. And if you don't have good interoceptive input, if you don't know when you're hungry, or if you feel like you're always hungry or you're not thirsty, those kinds of things will impact eating. So if you think that that's something that may be going on with your child, definitely talk with an occupational therapist and work on that interoceptive input. So after sensory, we have emotional. So anxiety, tantrums, stress-related symptoms. They're all typical behaviors that are exhibited by resistant eaters. It's really hard to say, it's kind of chicken or egg. Are the behaviors coming from the lack of nutrition? Is the lack of eating coming because there's all these behaviors? Like, it's hard to say what the causation is, but these are kids who may cry, they may gag, they may vomit, especially when they're presented with a new food. Like I said, neophobia is a typical part of development around that like 2-year mark. But some kids get stuck in it, and it really shouldn't last beyond 5 years of age. For some, it lasts into adulthood, and it can be really, really difficult in terms of social relationships. So children who don't get adequate exposure to new foods in childhood often become adults who reject new foods. So medical reasons why there may be picky eating, things like acid reflux and heartburn, having a history of aspiration. So aspiration is when a food goes down the wrong pipe and it goes into your lungs instead of into your esophagus. Having a history of tube feeding, constipation or chronic diarrhea, having celiac disease, lactose intolerance, having ulcers, having food allergies. I always say, you know, most kids live off of cheese, but cheese is a huge contributor to heartburn. So if you have a picky eater who only wants to eat cheese, it could be a vicious cycle. They could be getting a lot of heartburn, not want to eat certain foods because of the heartburn, eat the cheese, and then it creates that cycle. If you find that your child is avoiding certain foods or certain groups of foods, it could be a food allergy. And so it might be worth talking with your doctor or talking to a specialist about doing some food testing and just see if there are any allergies that are present. Developmental delays play a huge role. So diagnoses such as Down syndrome, cerebral palsy, autism, they can all affect the typical development of eating. There's a high correlation of problem eating in children who have disabilities. So like I said, I work with a lot of kids who have diagnoses, and like 90% of them are picky eaters. You know, for things like Down syndrome, they tend to be really low tone, which means that they kind of have that like flopped over kind of appearance. And so if they don't have that stability in their body, it's really hard to have that oral control to try new foods, eat new foods. For environment, I think this is a really big one these days. Households are really, really busy. You know, there's cell phones going, there's tablets, there's music in the background, the TV might be on. You know, people are in and out of the house. There's extracurriculars that you need to get your kid to, so you're rushing, you're trying to get them to eat so you can get to hockey practice or gymnastics or whatever. All of these stressful mealtime environments can really impact a child's eating patterns. So if they have a mild issue with maybe motor planning of the mouth, having all of these extra stressors can really impact the overall eating experience. So I always look at the nervous system like a bathtub where you have layers of water. So each stress adds a layer of water, and the more water we get, the more likely we are to overflow. So if you're working with a kid, or if your child has issues with oral planning, motor planning in the mouth, and then they're having a really stressful food environment, that's going to increase the level of water in the bathtub and be more likely to end up in, crying or having behavioral issues, that kind of thing. And so, culture has a lot of beliefs. So things like don't play with your food, don't talk with your mouth full, you can't have dessert if you don't finish your meal. Certain foods are for breakfast, while certain foods are for supper. We're raised believing all kinds of things that don't necessarily have to be that way. And so if you're working with if you have a kid who is a picky eater, try challenging some of what your beliefs are surrounding food, and maybe take a break, come back a little bit, and reevaluate how you're seeing some of these beliefs. And finally, behavior. So chances are your child isn't being a picky eater just to drive you completely insane. It's likely that they're dealing with one of or a combination of the things that I just talked about. Keep in mind that eating is one of the very few ways that kids can have some control in their life. And controlling what they eat is a natural step of establishing independence and autonomy. So it can be very frustrating, but just try to acknowledge that it hopefully won't last forever. So just a quick note on why it's important to build a healthy relationship with food. Resistant eaters can impair their long-term growth. So resistant eaters tend to have lower percentiles for height and weight. A lack of an adequate diet can impact academic learning. So it's harder to focus in school if you don't have all of the proper vitamins and minerals. In really severe cases, it can lead to hospitalization for malnourishment, and then improving socialization and self-esteem. So especially once you get to those teenage years, those preteen years, you want to go with your friends, you want to go on a date, the guy that you have a crush on wants to go for sushi, but you don't like sushi. So there's a whole self-esteem, socialization piece that comes into play there. So if you're looking to get some help for picky eating, you can start by talking to your family physician or your pediatrician. They can kind of point you in the right direction. They can rule out any medical concerns that there might be. And then working with an occupational therapist if you think it might be a sensory concern. Working with a speech language pathologist if you think it's more of a motor planning type thing. You can consult with a dietitian or a nutritionist. There's lots of options out there. So getting into some recommendations. So one of the first things I always tell parents is try really hard not to become a short order cook. That is a surefire way to burn yourself out, make yourself more frustrated. I always recommend trying to do a meal plan. So sitting down once a week and making up a meal plan. When you make your meal plan, include something that your picky eater will eat with every meal. They don't have to like everything that you're making, but make sure there's one thing per meal that they will eat. And then when you give them their plate, put a little bit of everything on it so they're getting exposure. If they don't like it, they can take it off. They can put it on a plate. I call it a learning plate in the middle of the table. And then you can have discussions about what does that food look like? What do you think it smells like? What does it feel like? What if it happens if I squish it? Those kinds of things. But try not to fall into the trap where you're making different meals for everybody in your family. That gets expensive and exhausting. Positioning. So I talked earlier about the bar stool example. It's really hard to get comfortable and sit on a bar stool for a long time. So a lot of kids that I work with, they really benefit from being well supported. I was working with a little girl who we tried this chair with. So this is the Trip Trap chair. I tried this one with her, and it's very customizable. So you can lift the feet up and down, so you have good foot support. You can lift the seat up and down, so you're at the right height with the table, and you can slide everything back and forth. So there's lots of customization. But this little girl that I was working with, the mom was really frustrated. I think she was maybe a year and a half old. And when I took a look at her in her high chair, her back wasn't supported, her feet weren't supported. And so she was kind of all over the place. As soon as she had good support, she started shoveling food into her mouth. So you don't have to go out and buy a big fancy chair like this. You can use like a stool under their feet. You can take phone books, if those are even still around, and tape them up so that you have something so that their feet are supported. Ideally, you want 90 degrees at the hips, 90 degrees at the knees, and 90 degrees at the ankles. And you want the elbows, you don't want the elbows up too high. You want them at a comfortable position. Like you wouldn't want to sit and eat with your hands at the same level as your mouth, right? You want to be in a good ergonomic position. So let them get messy, especially when they're young. Let them smear food all over their face. Let them, explore their textures. Let them cover everything with their hands. So this is my little guy. You can see just how he's loving this experience, right? He is just smashing it all over his face. Try to resist the urge to wipe their face multiple times during a meal. Just let it happen. It's all part of the process of learning to tolerate food textures. So making meal times family times. So everybody sits at the table for meals. There's no cell phones, no TV on, no distraction. It's time to sit down. It's time to, have family time, have a discussion about how everybody's day was. Some families that I work with will talk about, what was really great and what was really what you struggled with that day, what you're grateful for. You can have different conversation starters, but having meals together goes a really long way. It also helps with modeling. And so that's when the parents or the older siblings or even the younger siblings are modeling good food habits. So they're eating lots of different foods in front of them. And so that child is seeing all of these experiences. So this picture here, this is my son and my husband. And this was I think he was about 3 or 4 months old in this picture. So he wasn't eating solids yet, but he was still at the table with us. He was still getting exposure to all of those smells, all of those sights. He was really interested in food by the time it came to start giving him food. In fact, he helped himself to my food before it was time. So starting young, like I was saying, so this is my little guy in his Trip Trap chair. He's watching his dad. I think he was making pickles, but just getting them involved in the kitchen. And this was our way of getting him involved when he was really young. So we would do tummy time on the table during meals. So over in this picture on the left, he is locked in on that Mary Brown's. He is taking in all of those sights, the textures, the smells. So I know for a lot of you, you're beyond this stage, but if you have somebody that you're talking to who has a young child, you can make these recommendations to really start off on the right foot when they're super young. And we never left him on the table. We were always nearby. He wasn't at risk of rolling off. So here, again, this is myself and my son. I always had him strapped to me. Here I'm peeling sweet potatoes. So again, he got to experience what it's like to start food prep. Once he got a little bit older, he started reaching for a few things. Here he is checking out a big pot of chili that I was making. So again, getting those smells, the textures, the temperatures, all of that kind of stuff. So I touched on this a little bit already, But eliminating screens from the table, I often hear parents who say it's the only way I can get them to eat is by putting them in front of a screen. It is true. A lot of kids will only eat if they're in front of a screen. Oftentimes it's because they are so distracted by what's happening on the screen that they're not even like, they're just in like autopilot and they're not processing anything on their plate. I know myself, I'm sure a lot of you can relate to this. If you're watching a movie and you're just eating popcorn and then all of a sudden the popcorn's gone, right? It's like, where did the popcorn go? So you're not really having that mind-body connection with your food. You're not being mindful of what you're putting in your body. You're not paying attention to your body's hunger cues. So you're not realizing when you're satiated. So there's a lot of things that the screens can really interrupt. And so it's best if you can get rid of the screen, start at the beginning, and rebuild that relationship with the food. So try to relax. I know it's hard, but food should be enjoyable. It shouldn't be a point of stress. Don't blame yourself if your child's a picky eater. Take the time to introduce the food to a child. So talk about it. What does it look like? What does it smell like? Have all of these conversations. What does it feel like, right? Like touch it. Feeding therapy shouldn't be done at mealtime. It should be done either at snack time or just randomly throughout the day. You can do it away from the kitchen table. So either sitting on the floor, sitting at a play table, but just taking the stress out of that experience. You want to find a time when all of your focus is on your child to explore new foods. So, carving away 10 minutes a day, 10 minutes a couple times a week to introduce a new food, play with it, but not at mealtime. And tell the child that it's okay to spit things out. If they don't like the way it feels in their mouth, that's okay. Teach them to do it respectively, but it's okay to not like certain foods. So getting your child involved in meal prep can go a really long way. So you can get your child involved in like tearing the bread, if it's the stuffing, if you're making stuffing, have your child cut foods into fun shapes using cookie cutters. You can make like faces on your waffles with fruit. Just have fun with it. Try not to stress out about it. New foods are a lot less scary if they're fun. And then one thing that I've found since having my own child is taking videos of them in the kitchen and then showing them those videos later on. So then you can talk about, oh, remember that time that you did whatever? That was really cool, right? Did you want to try that again? And then increasing that tolerance to that food. So this is this picture on the right. My little guy was taking the skins off of frozen tomatoes. And then this one here, I'm just going to make sure it's muted. So here, my little guy is playing with a piece of celery, and I was chopping up celery for soup or something. And he was really interested in it. So I set him up in we call it his learning tower. So he's at a good height for the table or the counter. That's a crinkle cutter. So like one of the things that you use to cut like potatoes with. And he had a great time just learning how to cut the celery, trying to put it back together, all of that stuff. Oops. And so just other examples of getting your child involved. So on the left side, my little guy has a spatula and he's scrambling some eggs. In the middle, he is putting toppings on a pizza. So he actually helped to spread the dough out. So there's lots of tactile info there, lots of smells coming from the sauce and the texture or the toppings. And so he was super into making that pizza. And then in the top one here, I think we were making some kind of a stir fry. He was adding broccoli into the stir fry. I think a lot of the rice also ended up mixed in with the stir fry, but it's all part of it, right? So we always try to have fun and bring him along when he's interested. If he's not interested, then we let him play or do whatever. So slow introductions are important to keep in mind. It may take between 15 and 20 exposures of a food before a child will accept it or try it. Once they do like a food, make small changes to that food. So if it's carrots, if they like them really, really like soft, like really well cooked, you can slowly cook them less and less and less until they are almost raw. So you're changing the texture. You can try different shapes. So you can use a crinkle cutter. You can cut them into medallions. You can cut them into sticks. You can get matchstick carrots. You can try introducing foods into foods that they already like. So if your child likes vanilla yogurt and one of your goal foods is strawberries, you can take like tiny, like I'm talking minuscule pieces of strawberry and add them into the yogurt, mix it up and get them to try it. Once they tolerate that, make those pieces a little bit bigger. So you're slowly changing the food that they like into a food that they don't like. So lots of opportunities for exposure. I've had families that have had good success just by putting the Food Network on every once in a while and letting the child kind of play in the vicinity of the Food Network, because there's always new foods being prepared and done in different ways. And so it's a good way to kind of get kids interested in food. You can read books about food. So I'm working with a little one right now, and one of the goal foods is pasta. So we're going to read some books about, I think it's called like Super Spaghetti, and like there's a bunch of library books that we're going to get talking about pasta and making it kind of fun. One of the really important things to do is to maintain your child's trust. You don't want to start making progress and then have your child find out that you're hiding spinach in their smoothie when they didn't know about it. And so all of a sudden, all of that trust, or all of that gains, all of those gains that you've made have now been compromised because they don't trust what you're putting in their foods. So I always make sure that the child's involved in the decision, that they're comfortable with it. And so you're not ruining that trust. Having a team approach is super important. So making sure that everybody's on the same page. So you can talk to the school, you can talk to the daycare, having other medical professionals, making sure that everybody's on the same page so that all of the child's environments can reinforce the same things. And most importantly, you want to have fun. So it's okay to play with your food. It's okay to make a mess. Don't be afraid of making a mess. Let the child squish the food, smash it, squeeze it, paint with it, swirl it on the table. There's never any pressure to try it. Just make sure that they're comfortable around these foods. So you can give foods a fun name, like you can have banana boats or pretzel lightsabers or whatever your child's favorite toys are, their favorite TV shows, right? Like play off of what your child is super interested in. So on the slide here, we have a little one that is doing finger painting with chocolate pudding. You can take vanilla pudding and put food coloring in it to make different colors. So you can like make rainbows or whatever. These mason jars are filled with dyes made from different types of food. So you can look up some tutorials and make different dyes. You could tie-dye a t-shirt or tie-dye a pillowcase or a headband or whatever they're interested in, but you can do it using real foods. You can make trains out of cucumbers and celery and carrots. You can practice beading with pretzels and Cheerios. Really, like, there's so many things that you can do. You're only limited by your imagination. And it's important to keep in mind that success is never just a nice straight line. There's always going to be ups and downs, and you'll think that you'll be making progress, and then you'll kind of feel like you're back at square one, and then you'll make a little bit more progress and then go backwards a little bit. that's okay. You're still taking tiny little steps forward. So make sure you celebrate those little moments. Celebrate the small things and make sure that your child knows that you're proud of them and that they're proud of themselves. So that is all that I have. We have about 10 minutes or so left. So what questions do you guys have?
Okay. Thank you so much for that. I do have a few questions that have been submitted beforehand. So one was, they have an 18-month-old who has texture issues. He will eat chicken and veggies if they are pureed or breaded, but if they are by themselves, he will maybe try it, but will just immediately spit it out and then refuse to eat for the rest of the day.
Oh no.
So their question essentially was, how can they overcome those texture issues, or any tips in general, really?
So generally with texture issues, I would do a lot of making sure that they're tolerating different textures with their hands first. So doing lots of messy play, doing lots of sensory bins, those kinds of things. And then also with the food, gradually changing the texture of the puree. So kind of like what I was talking about with the yogurt and the strawberries, start with your regular puree and then add a little bit of texture into it. So if it's like a really, really smooth puree, you could add like a few breadcrumbs or something in to make it a little bit of a different texture, and then just keep slowly changing the texture until eventually you get to the full, like the full texture of whatever food item it is. And also make sure that there's nothing medical going on. So I'd talk to the family doctor, just make sure that there's not like a narrow airway or anything like that that might be impacting his ability to swallow.
Thank you. And then we have, our son won't even try new foods. How can we get him to have just even one little bite?
Again, it's all about exposure. So having it on the table close to him, playing with it. Like if you put broccoli on his plate and he doesn't want broccoli, put that learning plate on the table, get him to put the broccoli. So at least he's touched the broccoli. He's in the same environment as the broccoli. He's tolerating being next to it. And then just like slowly building on to that relationship. You can get him to try like tiny little bits of it. If he likes applesauces, you can like add purees to applesauces to get the flavor without getting the texture first, and then slowly increasing the texture in the applesauce. Like you can even get like apple and broccoli purees at Loblaws or wherever you use groceries, and then like slowly changing the textures of those by adding actual broccoli into it. So like it's really about gradually changing foods to widen that window of tolerance of the food.
Okay. And then you kind of talked about, there's you have to introduce it so many times, like it's there, you're not just doing it once and it's one and done. Is there a magic number? Like what point would you just accept, okay, he doesn't like broccoli, and like just leave it at that?
I've always heard like 15 to 20 times, but it can be way more than that even. Like I think 15 to 20 is like a typical average range. I would never like give up on a food. Our taste buds change all the time. I forget what the number is, but like kids' taste buds change every few weeks or every few months or something. So something that they didn't like at one point, they might like again in the future, or something they did like, stopped liking, they might like again. Kids are really unpredictable. In case you didn't know that.
So sorry, I just got to pull it up again. Do they grow out of it? Is this like, I know I was a picky eater. My husband still calls me a picky eater. I feel like I've got better. According to him, no.
My husband and I had the same conversation, right? But do they grow out of it? Like I don't have a magic ball, like a magic.
Just kind of case for case. Sorry, my cat.
Yeah, It really depends on the person. It depends on how motivated they are by it. Like if they really don't mind being a picky eater, they may not find that intrinsic desire to increase their food repertoire. I know for me, it was like my final year of university. I really felt like, okay, Steph, you need to start trying new foods. And so there was a lot of gagging and a lot of like, oh, I don't want to do this, but now I eat fairly well. I still don't like mushrooms, but we all
I'm
have
with you
it.
there. I'm with you there. Oh, sorry, where did it go? Sometimes kids, I know my son has done it, want to try something like really weird, like a really weird combination of just let it happen.
Yeah, just let it happen. It's all part of experimenting with food. And I remember, I think it was Full House, Michelle like combined ice cream and pickles. And I was like, yeah, that's what kids do, right? Like Uncle Jesse was like, you like ice cream, you like pickles, don't combine them.
Yeah.
But it's all part of experimenting and all part of like, okay, I like this, I didn't like this, like finding where those limits are. And I say go for it.
All right. That's what I figured.
Yeah.
And I was actually really shocked to hear that the age and when we can expect them to like really sit is so much older. That just blew my mind.
It blew my mind when I heard that too.
So my question is, as you know, like I work with the daycares a lot,
Mhm.
and I mean they have 15 kids in a toddler room or 16, like up to 24 potentially in a preschool room. What do you suggest to those educators when they have, there's the odd one that just they do not want to sit, and then it's kind of a monkey see monkey do scenario?
That's a really good one. Yeah, I want to say like let the kid who doesn't want to sit like get up and roam around, and then like other kids might do it, but they'll probably be more motivated by food, and so they'll want to stay at the table. But if a kid needs to get up, because like little kids don't actually get great awareness of what's going on kind of below their waist. And so to get up and move around, they increase awareness of like their lower abdomen, of their legs, of their feet. And so they realize when they're moving, this is my whole body. And so then they can sit down and they can sense where their body is in space. And so they can enjoy their food better.
Right.
So to take that away from a kid who needs that could be really detrimental. And so that could actually impact that child's relationship with food.
Right.
So it's very complicated. I don't know if that helped at all.
No, I mean, it makes sense. It is hard because it also becomes like a safety issue too. With you have not enough staff in the room to be right there with them, right? So more often than not, it's like you need to sit. But I know in my experience, there have been a few that just like they just can't. Like, it's just not in the cards for them. So
I would recommend like trying to keep things super interesting at the table. Like I touched briefly on if there's a lot going on, there's a lot of social connection happening, there's oxytocin being released. And so that's that love hormone. And so you feel really good when oxytocin is released. So you're going to want to stay in a situation when you're having that kind of like a mini high. Kids who aren't getting that at the table will leave the table and look for it elsewhere. So if they're getting it from a certain toy, they're going to want to go find that toy.
Right.
So increasing that social connection, like you can tell stories, you can tell jokes, you can like do whatever at the table to increase the child wanting to stay at the table. So that might be an approach for them to take.
Perfect. And then I think I'm just going to take a quick look at Facebook, make sure I have not missed anything, but otherwise I think I have them all answered. If anyone thinks of something at a later date, please feel free to email me. I can always reach out to Stephanie, and she's really good at getting me the answers or sending me in the right spot or what have you. I do have someone who just has a question specifically for you that we can touch after we kind of end this. Michaela, if you want to stay on for just a little bit, and then I will we can chat with you for a bit. But otherwise, once again, thank you so much for joining us. It was a pleasure. I learned a lot. And as a picky
Good.
eater, I feel like I wasn't just giving my mom a hard time. There might have been some other stuff going on.
I can definitely relate to a lot of this.
Yeah. But yeah, thank you so much. Again, if you have questions, please reach out through email and I will do my best to get you the answer. So without further ado, have a good evening, everyone. Thank you so
Thanks,
much.
everyone.